We're here at the 2018 CROI. We're here with Mitchell Warren from AVAC, and we appreciate you once again taking the time away from the busy schedule.
My pleasure.
To do this, and you're full of information, and you can talk about anything, and I can listen to anything. But it's important to get the pieces that are missing from our videos. And I think we talked. Why don't we just say your take on the ring before we get started? Because I know that we've done other talks on that. But.
Sure. Well, I think what's interesting about the vaginal ring is it's deja vu all over again. Mm-hmm. And we think about oral prep, but this conference has evolved over the decade. That oral prep must have been in a quarter of the presentations of this whole conference. Mm-hmm. And when I think back a decade ago, people weren't talking about prep at all, other than to be critical of the original research trials. Mm-hmm. And we think about it now as this powerful innovation that isn't having as much impact yet as we would like, but it's beginning, and we saw data presented throughout the week that it was beginning to show data. We have to remember that we're sitting here in 2018. The very first results of oral prep came out in 2010, almost 8 years ago. And so when I think about that 8-year window, that deja vu all over again, as I just saw this morning, the dapivirine ring interim results of the open label extensions. And it is mirroring the experience. You have a phase 3 trial of a user-initiated method, placebo-controlled. People wonder if it's safe and effective because, of course, we don't know. That's why we're doing the trial. And you don't know if you're getting the active product or a placebo. And what you saw in IPREX, the first PrEP trial in MSM, what you saw in Partners PrEP, the trial in Eastern Africa with serodiscordant couples, what you saw in pretty much every PrEP trial is that when you transitioned into the open label extension, adherence and effectiveness went up. And we just saw that presented here. And the numbers are so remarkably similar to what we saw with IPREX. And yet, in what came next with PrEP were the larger demonstration projects, the IPREGAY study in France, the PROUD study in the UK, and then many other demonstration projects.
Australia now.
And Australia now. New York City launched a new campaign just yesterday. You're seeing so much vitality in the space and beginning to see increased uptake, you're beginning to see increased adherence, and you're beginning to see impact on the epidemic. And remember, too, in 2015, we had the data from Kaiser Permanente in the United States to show that no man on PrEP with detectable drug levels had any infection at all. That was 5 years after initial efficacy. So we're on a cascade. We started with the phase 3 trial, modest effect 30%. With IPREX, it was 40%. Open label extensions got it up to 50%. But we already saw interim analyses and sub-analyses to show that higher adherers had higher levels of effect. And then with oral PrEP, we got into the demonstration projects, the PROUDs, the full-scale implementation, and you're beginning to see not just 80% efficacy, but you're beginning to see impact. Will we see that with the dapivirine ring? I don't know. But it's certainly, from a historical perspective, we are on a similar trajectory. And it really speaks to the opportunity. It also speaks, the other thing for me that was really striking here at CROI this year, which again, we knew this was already happening, is we have enormous inequalities in our health systems, whether you're in the United States, or whether you're in Europe, whether you're in Africa.
It doesn't matter.
And PrEP has really helped to highlight those in a more dramatic way. So we see higher PrEP uptake amongst people who are well educated and have higher incomes, and minority populations particularly are not yet reaping the benefits of PrEP. So we have a lot to do, and I think for me, and this comes up so often, Fred, when you and I talk, I'm always reminded of Tony Fauci. His takeaway line is, much accomplished, much to do. And this CROI had no real blockbusters. It had a lot of interim steps forward. It told us that we are accomplishing a great deal. We're beginning to see treatment scale up. We're beginning to see those cascades that were once quite leaky getting fixed a bit better and beginning to keep people in the system for treatment. We're beginning to see PrEP and now the dapivirine ring provide additional prevention options. We are in this moment of incremental progress, much accomplished, but much still to do, not only to realize the overall benefits of these newer approaches, but also to ensure that they do not exacerbate the inequalities, but rather they can help us address some of those inequalities.
And the clusters that they spoke about are really important to address vigorously.
Oh, absolutely.
And as Dawn Smith from CDC was saying, we know who needs the PrEP. We know
Absolutely.
who needs all the education, and that's where we should be pushing the ep, because that's where we can do the most good.
Absolutely. So I was really excited. I think so many presentations, both from the CDC here in the US, but also a number of presentations from international collaborators, really helping us understand so much better about this epidemic. So when I look, sitting here in 2018, we've learned so much about the virus itself. And that's how we have this whole panoply of antiretroviral drugs. We now have all of these new neutralizing antibodies that have been discovered because we understand the virus better. And that's been this incredible knowledge generation over the last decade. And now we're beginning to turn that also to understand the epidemic itself much better. Where is it? Where is it not? Where should we direct our resources? It's so easy, the analogy about, you only look for your keys under the light, but that doesn't mean they're necessarily there. It's often looking in the dark. And so all of the data I'm seeing presented here at CROI is, there are more lights being shined in more places to help us understand who needs what. How we might deliver it. We still have a long way to go, though. We have to understand not only who needs it, but who wants it, and we should never confuse the two. The fact that we now know where the needs are greatest doesn't mean they want self-testing. It doesn't mean they want oral PrEP. It doesn't mean they want the dapivirine ring. It doesn't mean they want an antibody or a vaccine, which we don't yet have, but a lot of advances there. So we know a great deal more about where we need to direct our resources. I think for me, the next biggest area of investigation has to be, how do we deliver the right kinds of programs to best effect to those people that we now know are most in need?
Right. And we don't want right now, a lot of municipalities were saying over the years, maybe we should wait and see how this plays out. Demonstration projects, all that sort of, we're beyond that.
Absolutely.
And so I think now that it's to the point of negligence.
You're absolutely right. So there is still a great deal we don't know about the virus, about the epidemic, about individual users, about treatment, and about prevention. But if we ever take a step back to say, we have to answer all the questions before we act, that would be the greatest tragedy. And I think one of the other subtext to all of this, and just today, a number of advocacy partners working with scientists released a letter signed by 200 leading scientists and researchers, basically talking in this country about the importance of evidence, of acting on what we do know to more aggressively address what we don't yet know. And it comes at such a critical moment. We talk about this all the time. We have these tipping points, both within the epidemic generally, within municipalities, within states, within countries. And yet, we also see the political winds and the economic winds making it much harder to think about a sustained response to this epidemic. And if we, for 1 minute, step back, we will tip back so much faster than we can possibly tip forward. And if we do, my big worry is that we may never be back in this position again to be able to tip forward. So I think the politics of the day, particularly in this country, are something we have to watch remarkably closely. It shouldn't be this complicated. We have made such progress. When I think about what PEPFAR has done globally, what I think about what the CDC and the National AIDS Strategy, which we finally had just a few years ago, developed in this country with leadership from the previous administration, if we don't optimize, if we don't build on those successes, both domestically and internationally, we may never be back at this moment of opportunity again. And I think that's what's so frustrating. We are far from ending this epidemic. No one should be on any illusion. Yes, there's the fast track to epidemic control. Yes, we're talking about 90, 90, 90. We have an enormous amount of work still to do. So this epidemic is far from over. So we need to be smart about the science we do. We need to be smart about the implementation that we do for both treatment and prevention, about human rights-based approaches, and we need to be smart about the financial investments we make, because we are poised to do great things in terms of epidemic control, but we will only be on track for that epidemic control if we reverse funding cuts, if we prioritize human rights, if we recognize the centrality of the individual, if we recognize that fundamentally we have got to have a comprehensive, integrated, and sustained response. If it doesn't meet all three of those words, comprehensive, it has to be inclusive, it has to be integrated, these pieces have to fit together, and it has to be sustained. This is not a 2-year effort. This is not even a 5-year effort. If we are going to end this epidemic, it needs to be sustained for the long haul, because 41 million people live in this world who need antiretroviral treatment. Only half of them currently get it, and every year we're adding 1.8 million more to that denominator. So it's 41 million people today. It's going to be 43 million people a year from now. So we have got to get way ahead of this, and we've got to keep a very strategic, long-term view to how do we have this sustained response to this epidemic.
And we need to, and just to add to that, we need to have more activism from the grassroots,
Absolutely.
like we saw at the opening with TK. I mean, this is, if we had a lot of him out there that we move. So we need all those things that you mentioned from all the directions, but we need the ground up too.
Absolutely. You know, when you look back now 37 years in this epidemic, I can't think of a single advance that has happened despite community or without community activism.
Yep.
Every treatment advance, every prevention advance, every human rights advance, it took the greatest scientific minds. It took leadership from, the NIH, from PEPFAR, from some administrations in the past. It has always taken scientific brilliance. It's taken some luck. It's taken political leadership, but it's always, every one of our advances has been with community and activism and advocacy as part of that process. So when I talk about this idea of a comprehensive response, it's not just antiretroviral treatment
everything.
And PrEP and circumcision and condoms. Those are all part of comprehensive. But comprehensive also means scientific leadership, community leadership, political leadership at all levels, whether you're talking about what happens in the Back Bay of Boston, whether you're talking about the state of Massachusetts, whether you're talking about this country, whether you talk about any country or the global epidemic. It's when science and policies and people, individuals, communities, activism come together. That to me is the lesson of 37 years.
And we're telling the people out there, become involved. You, everyone out there needs to be involved. Especially the people who can put a voice to it, who are in need.
Absolutely.
Those are the people who need to be out.
And particularly, one of the things that we talk a lot about young people, and it's easy to say, we've been doing this for too many years.
Look at the kids in Broward, what they're
well,
doing.
absolutely. And we need that activism in every walk of life. And I think about HIV, some of us have been doing this a long time, some would say too long. None of us thought we would be doing it this long. We've got to be thinking about the next generation. And that's true whether you're running a lab in an academic setting, whether you're in industry, whether you're in community advocacy. What's the next generation going to look like? Because we need a long haul strategy. This is not going to just be over because we wish it or because we have global targets. We have a lot of work to do.
The kids are smart and well connected.
Totally.
So we just have to get them engaged.
Absolutely.
With
And they
the
need to know that
message.
we're not over, but they also, and this is this balance, always, it's, there's so much reason to be hopeful and optimistic about the AIDS response. I mean, really, when you look back and think what we've accomplished as a global community, with 20 million people on antiretroviral therapy, with advances in prevention, with PEPFAR, with the way countries are working to address their epidemics, there is so much to celebrate and be hopeful about, but there's so much work still to do. And so that's always this balance. We shouldn't sugarcoat it. We're not done yet, and if you think we are, you're wrong. We have a lot to do, and we need to make sure young people get that. And we have to also remember that there are more young people today in every country than there were when this epidemic started.
And they're
That's
gonna have
this
to take the
demographic
leadership.
change.
They're going to have to
Absolutely.
take the leadership.
Absolutely.
So I really appreciate us pushing that. And if they're listening, get engaged. There are plenty of places to contact. We have a whole list of people that have been involved with our videos.
Sure.
And you don't have to look far on the internet to find who in your city
Is doing stuff.
is doing stuff that you can be involved with.
Absolutely. And here's the other thing. If they're doing great stuff, be involved because it's great stuff. If they're doing things that don't make sense, get involved because you can address that.
Exactly.
And that's the power. You can build on the successes that we have, and you can address the deficiencies when you identify them. So that's the beauty of all of this. There's great stuff happening that we should be doing more of, and there's some really bad things happening that we need to address and course correct for.
I think you're truly activist savant. You get me always charged up every conference.
I'm delighted we're still here. I look forward to
We
a
wish
time when
we
we don't
weren't,
have
but
to
we
be.
are.
Exactly.
Yeah, right, exactly.
Fred, thank you so much.
Thank you.